Welcome to the 8th Annual JCB Lecture in Ethics and Governance of AI for Health. My name is Jennifer Gibson, and I'm the Director of the University of Toronto Joint Centre for Bioethics. This year's lecture represents a special collaboration as it is co-hosted by 3 contributing centres in addition to the Joint Centre for Bioethics. Transform HF, which is an institutional strategic initiative of the University of Toronto in collaboration with the Ted Rogers Centre for Heart Research, which aims to build and implement innovative digital technologies for equitable, sustainable healthcare. Second, the Collaborative Centre for Climate, Health and Sustainable Care, a multi-faculty academic unit at the University of Toronto dedicated to advancing climate and sustainable action for health and across health systems. And then finally, the Temerty Center for AI Research and Education in Medicine, known as T-CAIREM, a center located in the Temerty Faculty of Medicine at the University of Toronto, dedicated to advancing research, education, infrastructure, and community for AI in medicine. We are also delighted to host 4 spectacular scholars. Our keynote speaker is Assistant Research Professor Loïc Lannelongue from the University of Cambridge, and 3 panelists, Associate Professor Dr. Mamatha Bhatt from the University of Toronto and the University Health Network, Scientist Dr. Chris McIntosh from the University of Toronto and the University Health Network, and Associate Professor Jay Shah from the University of Toronto, who will together explore the topic of the sustainability challenge of modern computational science. But first, let me thank all of you for joining, both in person and those of you who are joining us online today. I will say a bit more about the mission of the JCB Lecture on Ethics and Governance of AI for Health in this year's lecture in a few moments. But first, I would like to invite you to join me in opening today's event in a good way, by acknowledging this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. The mission of the JCB Lecture on Ethics and Governance of AI for Health is to provoke discussion and to foster interdisciplinary engagement on the ethical, social, and political issues associated with the development and use of AI in health. The lecture began in 2018 with funding support of AMS Healthcare. We are very grateful to AMS Healthcare for its continued partnership in exploring AI and the future of caring through the JCB's Ethics for Good Health program and this annual lecture series. I know that you're all eagerly waiting to hear from Dr. Lannelongue, but I have a few housekeeping items. The format of today's lecture is as follows. Dr. Lannelongue will present for 45 minutes, which will be followed by a facilitated dialogue between Dr. Lannelongue, Dr. Bhatt, Dr. McIntosh, and Dr. Shah, and then we'll open up for a Q&A session with you, both in person and online. During the Q&A session, we will take questions both in the room and online. So if you happen to be online, we ask that you please put your question in the Vimeo chat box. Ideally, we'd like to field as many questions as possible, so we would ask if you could keep your questions brief, and I will do my best to moderate those questions to facilitate as much discussion as we can with the time we have. Finally, I will note that today's lecture is being recorded and will be posted for future viewing on the YouTube channels of the Joint Centre for Bioethics and the Collaborative Centre for Climate, Health and Sustainable Care, and on the T-CAIREM website. For those of you participating in the Q&A in person today, your voice may be heard on the recording, but your image will not be visible. Now, I'm pleased to introduce today's speaker. Loïc Lannelongue is an assistant research professor in the Department of Public Health and Primary Care, where he leads the Cambridge Sustainable Computing Lab, a research group studying the environmental impacts of computing. Passionate about environmental sustainability and responsible science, he's involved in both research and policy internationally. He is a Software Sustainability Institute Fellow, a visiting scientist at the European Biometric Institute, and an associate fellow of the Higher Education Academy. He is also Director of Studies in Computer Science and a BI-fellow at Jesus College, Cambridge. Thank you all for coming. I hope you enjoy today's lecture and discussion. And please, Dr. Lannelongue, I invite you to the stage.
Thank you so much for the introduction. And thank you for having me. So happy to be here to talk about that, and very much looking forward to the discussions afterwards. So I always have this slide at the start, mostly to say I'm not here to say AI and any kind of computing is terrible, let's not use any of it. No doubt it enabled amazing discoveries. I completely randomly picked 2 examples here. I'm sure you can all think of some examples in your field. For the topic of today, it also helps in the fight against climate change. Again, random examples. In biodiversity monitoring, for example, we can find great applications of AI. You can use it to optimize energy grids in cities. The examples the list is quite long. So that's all to say it's out there, not denying its presence. But it comes with a cost. And the link between the 2 pictures may not be immediately obvious, but globally, the carbon footprint of data centers is estimated to be the same as the entire American commercial aviation. That's around 120 megaton of CO2, if that rings any bell. So, not completely negligible quantity. Couple of numbers to start with. 45%. According to the ITU, which is the International Telecommunication Union, that's by how much we need to reduce the greenhouse gas emissions of the digital sector by 2030 to be on track with the Paris Agreement. And there's going to be a bit of a theme here. That doesn't mean doing 45% more communication with the same carbon footprint. It means reducing it by 40%. And I'll get back to that a little bit later. The other number is 2. I'll try not to throw too many, but I'll have to mention some quantities of carbon. And it's always a little bit hard to really realize what that means. 2 tons per year per person. That's the annual allowance if we really want it to be in line with planetary boundaries. And that's the kind of target set by the IPCC. None of us in the room are probably under that number, but that's the target. Okay, so I picked a couple of examples from AI because of the topic. It's quite hard to understand really the carbon footprint of AI. And even particular models, especially since the whole ChatGPT thing got released and we're really in an era of generative AI, companies building these models have been quite protective of the numbers and really understanding what are the resources behind it, which made any kind of estimates quite hard. That's why, for example, this paper was released 3 years ago, and the first line is GPT-3, which is basically the last open model before ChatGPT got released. So it's kind of an ancestor of ChatGPT before it became a closed model. And they found that training it once, doesn't include retraining, doesn't include anything else, just training it once requires 550 tons of CO2. So if we compare it to the 2 tons we were talking about before, that's quite a lot larger. More recently, Mistral, which is a kind of French OpenAI competitor, published a quite extensive study. There are a lot of limitations on it, so it's not to say it's a perfect study, but it is a study, and they try to estimate the environmental impact of training their model, and they actually acknowledge that it goes over an 18-month period, so it's not just the one-off training, it includes research and development. The numbers are quite striking. Over that period, we're talking 20,000 tons of CO2, right? We were saying 2 tons per year per person was the target. 280,000 cubic meter of water. And the last unit, that's 660 kilograms of antimony equivalent. That probably doesn't mean anything to anyone. And that's a unit we use to quantify resource extraction, so minerals and metals. For context, I think the planetary boundary per person for that would be about 0.03 kilograms. So again, 660 is actually quite a large number in context. And it's not just AI. When we started working on that, we actually worked away from AI. We said it's great to focus on AI, and that's an important aspect. But when we think about the way we do science, there are lots of science that has nothing to do with AI. In medicine, in weather forecasting, in physics, astronomy, bioinformatics, we can keep listing examples. And it's fine to look at AI. We just need to make sure we don't forget about these other impacts. Here are some numbers we got from a paper we published. I don't know. Anyway, we published a few years ago. The actual numbers are not super important. We're talking here dozens, if not hundreds of kilograms and tons. The numbers don't matter because they change all the time. What matters is the order of magnitude can be big enough for it to be an issue. So that's the conclusion of all that. Computing is not free. If you are in a startup using Google Cloud and AWS all the time, that's going to be completely obvious to you. If you are in a well-funded university, like a lot of us here are, actually that's not quite obvious. From a user point of view, it doesn't cost very much to run compute on institutional data center. And that's a bit of a problem. The good side of it, we can actually do a lot more research than we could if we had to compete with big tech companies on cloud computing. But because there's no cost, there's no reason not to waste it. There's no incentive to be good about it. And I'm sure you all have heard PhD students or postdocs saying, well, it doesn't really matter. No one's using the server. I may as well run this thing that no one really cares about. Oh yeah, sure, it crashed after a week. Doesn't matter. I'll just restart it again. And that's part of the scientific process, but this absence of cost is a little bit of a problem. Who would start a clinical trial or a wet lab experiment being like, I have no idea how much it's going to cost. May cost £10, may cost £1 million. Who knows? Or dollars for here. But so that's this idea of compute cost is something to keep in mind. I'm based in the Department of Public Health in Cambridge for kind of historical reason. And a lot of what the department works on are environmental impact of climate change and health impact of climate change and air pollution, worsening cardiovascular disease. And I'm like, okay, but we're using AI to try to optimize these models, so we're making the problem a little bit worse. That's a good way to keep ourselves in business. Slightly less of a good way if we're trying to cure it. And I'm not suggesting that we're having a net negative impact on society as a whole. I'm just saying we need to be mindful of the potential downside on the environment. Okay, so that's the roadmap for today. I'll try to tackle these three things in order, and then we'll have the Q&A to go back over everything I got wrong. I really like this quote. It's not actually from me. I couldn't really find who said it first, so I kind of just leave it there. But you would be surprised the number of people who don't think of the cloud as actual physical infrastructure. And I had to review a paper once where the main advice for sustainability was to say, don't stop using external hard drive to store your data. Just move them all to the cloud, so then you don't have to use hard drives. And you're laughing, but that was a paper submitted for publication, and yeah. No, but that just shows that a lot of people, because of the cloud naming, is actually a terrible idea. It just, well, depends which side of the debate you're on. But from my point of view, it's a terrible idea. And then you don't really think of it. You just think it disappears somewhere. It's all very nice and natural, and we don't have to focus on it. We can even do compute on the cloud. It's wonderful. It just magically appears. But it doesn't. It has very, very real physicality, and we need to remember that. Part of the reason why it can be complicated, and over the discussions I've had so far, it really comes up, is there are lots of different angles we can look at it. And we normally just take one of those angles, like kind of operational carbon footprint. That's what you always hear about, the cost of running things. But there's a lot of other ones, and I'll try to cover on it a little bit. So this embodied impact is what we mean by manufacturing, extracting raw material, and end-of-life cycle. So everything except actually operating the hardware. And it's hard to quantify because you can imagine the problem of quantifying supply chain. There are 100 different actors for each element, and you have to understand what everyone's doing. So it's quite hard. This paper here that was just released recently is really interesting. They basically took a GPU, so one of these specialist hardware we use to train AI, and they demolished it. They basically melted it completely to try to figure out how much of each rare earth material was included in that. So that's a bit of a heat map of what were the hot spot on it. So, and then they thought about, okay, how much does it take to actually train GPT-4? GPT-4 is what you have in ChatGPT at the moment, mostly. So if you use it, that's what you're using. And they found that it would take almost 9,000 GPUs. Now, I'm not saying that you need to use a little bit of 9,000 GPUs for a little bit of time. I mean that you use one GPU from the start of putting it in service for its entire lifespan of, let's say, 3 years. You throw it away because it's completely demolished. Then you take another one, and you repeat that 9,000 times. Obviously, in practice, we don't really do that. You kind of do it in parallel. But from a conceptual point of view, that's the same thing. So you completely use and destroy 9,000 GPUs to train it once. The result of that is 7 tons of toxic elements being released in the environment. Turns out, processing this kind of waste is not terribly good for your health. And so you can imagine the health impacts on that if that's an angle you're interested in. So that was an interesting way to quantify this training. These embodied impacts are really poorly distributed. So this lovely picture, if you want a new holiday spot, is Bautu in Mongolia. This has the largest factory to process rare earth elements. This is not a real lake, this is an artificial lake. And it's basically, the lake is lined with factories that are churning out this deep, thick chemical waste material, which is all the output of the factories that they need to actually process rare earth material for digital hardware. So that's a very real impact of building IT equipment. This journalist from the BBC that went there and took the picture, they said, you know, all these post-apocalyptic world videos or movies, that's kind of what it looks like here. And I'm jumping ahead, but you know, you hear about carbon offsetting and saying we can plant trees. Great. But you know, planting trees in northern Canada is great, but it's not actually going to help people who live around this factory, for example. And so we can't just think on a global level. We have to think about these local impacts. If we look at the other end of the spectrum, that's the slightly depressing slide of the day. There's this report by the World Health Organization that looks at what happens to electronic waste. They estimated that over 80% of the millions of tons of electronic waste every year are processed by up to 50 million of what they call informal waste workers, which means people working in dump sites with terrible protective equipment. It turns out that opening up a computer or a battery with your bare hands is not a terribly healthy experience. So it comes with absolutely dreadful health impacts. On children in particular, there are over 18 million children involved in the waste processing industry. And so it's worth thinking about the both hands. The manufacturing is a problem, the mining can be a problem, but also disposing of electronic hardware. If you take your smartphone or your laptop, 80 to 90% of its entire lifetime carbon footprint comes from manufacturing only, which means, you know, it doesn't really matter if you charge your phone every other day instead of every day. What really matters is to not change it every 2 years, because then you save these 80% from happening again. And we can't just think about the operational. We have to think about how we use the hardware and how we make it last longer, especially for our personal devices. That's really something we can do. Now, I've been quite guilty of that so far. All the numbers I gave you in the introduction, they're all about carbon and tons of CO2. But that's not the only environmental impact. The problem is it's really hard. I talked to you about kilograms of antimony equivalent early on. That makes it incredibly hard to actually grasp what kind of impact we're talking about. One framework that is quite interesting for that is the planetary boundaries. And in summary, it's a way of saying if we stay within these boundaries, we don't leave the Earth in a worse off state at the end of the year than it was at the start. We keep the Earth in a system that it can actually regenerate itself. We don't push it over the limit. So it's something that's been developed in Stockholm. They initially had 7 boundaries. Then they went on to 9. 2025 was a landmark year. We managed to cross the 7th one. So, you know, if we keep working hard, almost there. So if we just zoom in, you can see some of them, climate change and CO2 concentration. This is when we talk about carbon emissions. And that's one of them, but it's only one of them. So we need to keep thinking about things like land system change and freshwater change, ocean acidification, and all of these impacts. The reason it's so important is if we have this, and someone was mentioning that again this morning, this carbon tunnel vision, we can devise solutions that actually don't achieve anything we want. You can make something that is almost zero carbon, but if you actually destroy every other category in the process, probably not the best thing we can do. And so that's a useful framework to use. Now, it's not to say we should do nothing because it's too complicated, but we need to keep in mind this complexity. Okay, that was for the complexity. Now, if we focus on what we generally talk about, what's the carbon footprint of running things, of training an AI model, of doing weather simulation? Well, conceptually, it's not very hard to estimate. We can try to figure out how much energy we need, and that mostly depends on what we're doing and what the hardware is. And then we need to figure out the carbon footprint of producing that much electricity. And that depends on where we are in the world. All data centers are connected to the main power grid. Some of them are trying really hard to pretend they're not, but only very few are really not. So in practice, it depends where you are. And if we look at a data center, an average one, you may be surprised that only half of the power that actually goes into the facility actually powers computers. You get this big 40% that tends to be overhead, which is mostly cooling, mostly keeping everything nice and cool. And I do appreciate the irony of giving a lecture about global warming when you've had the most snow you've ever had in recent years, but here we are. This overhead is really interesting. It's generally quantified by this metric you may have heard of called PUE, power usage effectiveness. And it's actually quite straightforward. It's the ratio between the total power that you give the facility divided by the power that actually gets into the computer. So it's a way of measuring overheads. It has to be greater than 1. And all data centers are all competing on that. If you go on the Amazon website, they're going to tell you that the average is really low, which it probably is. But it doesn't tell the whole story. And actually, when we were writing the very first paper on this topic back in 2020, that was when the whole Brexit thing was being sorted. And there's the European weather forecasting system, which data center was built in Reading in the UK. And probably Brexit, probably other reasons, they decided to move it to Italy. And so there was this big announcement saying, look, we're moving our data center to Bologna in Italy. The new data center has a much lower PUE, and therefore it's much better for the environment. And I was kind of in the formula and doing the math, and I was like, wait, it's very linear formula. You kind of multiply your PUE by the carbon intensity of electricity. So I was like, Italy has much higher carbon electricity than the UK. So is it still a net benefit? Turns out they hadn't calculated that far. They just had stopped at the PUE. And so we did the math. And obviously the facilities are going to be different and everything, but assuming the compute stays the same, you couldn't offset it. That would result in an 18% increase in greenhouse gas emission because the gain in efficiency wasn't good enough to offset the gain in carbon emissions for electricity. And you would have really thought that people who were doing climate forecasting could have kind of figured that bit out. And they probably did, but it wasn't part of the press release. And so it's just one small example, just to show that we can't just rely on this metric like PUE as a kind of a gold standard. Storage is very complicated, depends on the hardware and everything. But actually, if you are worried about the carbon footprint of storage and you want to just have a rough number, that's the order of magnitude. 10 kilograms of CO2 equivalent to store 1 terabyte of data for a year. Now, that can sound like a lot or not a lot. 10 kilograms for a terabyte, if you think about your personal data, well, that's not that much. We don't have that much on our laptops usually. But when we start thinking about research data, that adds up very quickly. Especially because we never delete data, which is maybe good, but we should probably be a little bit better at this deleting things. And there's strong incentives. Funders want you to keep data for a long time, but there are lots of data we don't actually need. We need the raw data and we need the processed data. All the intermediary files we generally don't need, but we generally don't really remove. Why? Well, partly because it doesn't cost anything to store data. You know, we had this situation in the past where you hit the maximum storage limit and you say, oh, can you help us dig through the data? And they're like, well, for £20 a year, you can get an extra 10 terabytes. And you're like, fine, then I'll just do that. And so that's something, that's kind of a number you can use for a quick back of the envelope calculation. So speaking of the carbon footprint of producing electricity, if you don't know it, Electricity Map is a great website. You can go on there and you can click on countries. So for example, I did it yesterday morning for Ontario, and you can see how electricity is being imported. You can see how it evolves even like during the course of a day or the year and everything. And it's actually a really interesting way of looking at that. And there are great disparities between countries. You can easily multiply, you can have a factor 100 between two different locations. The US is particularly interesting because it's incredibly fragmented. So its energy grid is really, really fragmented, a lot more than for example, European countries where it's generally quite homogeneous. And so I had an example, I didn't put it here, but there's this example where you can just stay in the same state and just change county, and you multiply your carbon footprint by like 20. And just because one is fossil fuel and the other one has a solar farm or something like that. So something to keep in mind. And that means that there is opportunity with locations because we don't need to be next to our data centers. We can kind of play around and put data centers where they make sense. Okay, so I'll kind of, as a transition from all of this impact, quantification is a big part of what we focused on. So over 6 years ago now, we started this green algorithms project. And I'll highlight some of our tools and examples before going back to more interesting stuff. But the motivation here was to say, how can we empower researchers on the ground who make this decision, ultimately, of, we need more compute, we want to run this model. And it goes beyond researchers, but really people building the models, how can we empower them to understand the environmental impact? And then that kind of snowballed, and we ended up doing a lot of policy work, and I'll showcase a little bit of that. That was the first calculator. It came out after a few months. It hasn't actually changed very much since then. You can go on there. It's a bit like a flight calculator. You can say, well, I'm using that much compute. These are the CPUs, GPUs I have. This runs for that long. And I'm based in, well, here the UK, but I'm based in Canada. And that gives you estimates of energy usage and carbon footprint. And actually, there are estimates coming up of broader environmental impact. So resource usage and materials. We're just kind of thinking about how best to display this information. So that's been kind of a fun tool, and it's been quite popular. The good thing of a calculator that I didn't expect when we built it is, you can actually use it before you start a task. So you don't only retrospectively try to calculate your carbon footprint, but you can preemptively do it and say, I think I'm going to need that much resources. Do I think it's worth it? So you can really input that into your cost-benefit analysis. And actually for teaching, it's been a really popular resource for teaching. So because you don't actually need to run the compute, you can kind of think, what if you were running that much? So that's a great way for students to really kind of play around and see what would be the impact of different models or whatever field they're doing. There's now an AI panel for it. So the calculator works exactly the same way, but now with the AI panel, you can have the training phase and the inference phase. So both batch inference, so kind of the old-fashioned, you make prediction on a lot of data all at once, or the more continuous inference like a chatbot where it makes a prediction every time you query it. And so that all works the same way, but it's a good way to have it side by side. So Evan Matencio worked on that and did a brilliant job. I said the calculator didn't change that much since we started it, which is true. And Christina Bremer, who joined my team last year as a postdoc, she comes from human-computer interaction. So she was horrified, rightfully so, and thinking, what was the co-design process? And it was like, me as a PhD student sat at my desk, which turns out is not a very robust co-design process. So we decided to fix that, and we did it. So we basically ran a few workshops at the end of last year, just bringing together people who know how to build calculators, but also users, around the table, and kind of did a proper brainstorm, and they all brought in ideas, and that's the big job at the moment. We're trying to kind of extract useful information from there to revamp the entire calculator, but also put out some guidelines. What are good practice for carbon calculators? Because too many of them don't really have that. And if you're interested in that, get in touch or follow up, because what we think we're going to do is we're going to do a first round of all these like low-hanging fruit improvement, and then we're going to do more co-design to try to focus on the hard stuff. So that's going to be interesting. Another thing we had is calculator is great, but it's a little bit painful, right? You run a job 100 different times. It's not very handy to go in the calculator 100 different times. So we thought, okay, everything we do on an institutional data center, so if you use, I don't know how Toronto's set up, but in Cambridge, it gets logged. Because they charge you. Well, they charge you, not really. They charge your PI like a very nominal amount of money, but they do need to charge you a little bit. So they track what you do. And so I think it was a time when I was supposed to write my PhD thesis, and I really didn't want to. And so I wrote this piece of code that we ended up calling GA for HPC, which is very simple. It basically connected to the servers and just queried what are all my jobs for the past year. And then it would automatically apply the same formula the calculator does. And so that was kind of a user point of view. It's still online if you're interested. But that's not really handy. We thought the best thing would be to have this kind of dashboard directly installed on the institutional server. So any kind of user who uses it can connect and see their carbon footprint, their efficiency metrics, and so on. And so we've been working on that. It's not quite out, but if you want to see a prototype on fake data, you can connect with this URL here. And we're trying to just finalize it so that it's a bit of a framework that any institution can install it. And that comes from the realization that some large ones have very extensive computing teams that could develop their own dashboard. A lot of them don't. A lot of them, the team is very small, very stretched already. So it's to provide an open source tool that can just be installed, and then we don't have to think about it. So it's kind of coming together at the moment, and we're hoping to make it completely open source very soon. And basically, it looks like that for now. We're going to make it look different. But for example, you connect, you can see your carbon footprint, you can see your evolution over time, different metrics, different efficiency metric. You can see the carbon footprint of your failed jobs, for example, and that's quite interesting. Having a lot of failed jobs is okay. Having a very high carbon footprint for them, it's generally avoidable. But you can also see data aggregated by research groups in your department or aggregated by department in your institution. So you can kind of follow data along like that, which has been quite interesting. Now, that's the social science. I know some of you, for example, here work with Gabby Samuel, and she's a sociologist at King's College London. And we work a lot together. And every time she hears one of my talks, she's like, yeah, your tools are great, but does it make any difference? Or is it all for nothing? And that's a very fair question. And we decided to tackle it, to have, well, officially to have quantitative data. In reality, for me to have some answer to Gabby next time she asks me. And the answer is, so we decided to say, okay, let's deploy something like the dashboard I showed you, maybe with more community support, but let's deploy that in a lot of universities and see what happens, because we can collect compute usage. Do people use computing in a more sustainable way after deploying that? Does it make actually no difference? Well, I suspect is a dashboard alone probably doesn't make a big difference, but maybe with community support and training, you can actually affect change. Do researchers have more sustainable behavior on using computing? I don't know, but we're basically in the phase of finding out. If you're interested in that or interested in being part of that, do get in touch. We're kind of finalizing the protocol at the moment, but always happy to chat it through. So that's for the first part. Buckle up. No, but should we do anything about it? And that's a really important question. And actually presenting yesterday to cardiologists was even more interesting, because you're like, especially in health research, right? You're like, well, we're trying to cure cancer or heart disease. Should we really think about the environmental impact of what we do? And that's a fair question. Now, there are a couple of obvious low-hanging fruit here, which is resource extraction, hardware manufacturing. That's another view of beautiful Bao 2. It comes with very real health impacts. So we can't completely ignore that we're contributing to the problem in one way. Energy generation and the role in air pollution, again, very real health impact. And so I mentioned Gabby before, and I'm not a sociologist, so this is completely borrowed from a piece we've wrote together recently that's coming out in the next few weeks. But I thought that was an interesting perspective. So we were discussing, basically from an ethics perspective, and I know how risky it is to talk to a room that has ethicists in it, so there will be plenty of opportunities to correct me, but we were discussing about these two different approaches, right? The ecocentric approach says that plants and animals have moral values in it, or the anthropocentric approach, which says only humans have moral values. And what I found really interesting from it is like, basically they both agree on it, of saying we need to consider the environment in the first case because they have value, in the second case because otherwise we're doomed, and if anything, we need to save ourselves, which I kind of found interesting as an example. It's like, come at it from different angles, but ultimately agree that we can completely ignore the environment. And that all goes part to this like interconnectedness and this idea of one health, and we can't really have sustainable human health without thinking about all these other impacts. So being a kind of dumb scientist on my side, I was like, that's great, makes life easy. On the health side, there's also this case, and it's a quote here. If you're interested, do check out this piece by Jeff D'Souza here in Toronto and Gabby Samuel that I pulled the quote from, which is that there is a real argument to say that environmental harms should be part of this broader like harm and benefits that are dictated by biomedical ethics, and that's quite interesting. So there's some agreement on the ethicist side. On the public, well, a bit more complicated. So that's a survey. So the NHS, which is the National Health Service in the UK, they did a survey of what the priorities are. And minimizing the NHS impact on climate change and the environment is second to last. Actually, the only worst one was providing more services online and through your phone, which for today's topic is kind of funny. It's the only thing people cared less about it when you hear the discourse in the UK. Anyway, that's a separate topic. But interesting, and you know, I can't blame people for that. You know, waiting lists, and they are so much more pressing issue. But that just shows that from a political point of view, it can be hard to push for sustainable NHS. And so we tried to take a step back like a few years ago, and we thought, many of you are probably familiar with the FAIR principles for open data, of making them findable, accessible, interoperable, or something. Can't remember it, never mind. We thought, can we come with something reusable? That's the one. Can we come up with something a little bit similar for computing? So we came up with these greener principles for environmentally sustainable computational science. The title's a bit of a mouthful. I have to say, this was done before ChatGPT, so I had to sit down and figure out an acronym that worked for greener. I couldn't actually ask it. That's why it's a little bit wonky. But the idea was, okay, governance, responsibility, who is responsible, who has a role, who can make a difference? And the answer is a little bit boring, it's everyone, but in different ways. You need bottom-up approach, you need people on the ground, so early career researchers are so important for that, but you also need top-down, you need funders and head of governments and PIs to really be involved. That's like the sustainability sandwich, one of my friends saying, which I quite like. Otherwise, I've covered some of the other things, the possibility for new collaborations, but we were just trying to put a bit of a framework on it. So then there's a bit of a debate on the yes versus no side of should we, remember on the question, should we think about these environmental impacts? Maybe not terribly surprisingly, big tech is not on the yes side. Actually, they would wholeheartedly dispute that characterization. And I've got that. There's great effort coming out of big tech companies on sustainability. DeepMind team on sustainability has really good effort about how they make their data center compute follow the sun in a way, and they try to move compute loads to data centers that have more renewable energy. Microsoft put a data center underwater. They basically put it in a big tank and then just dump it at the bottom of the sea. Didn't touch it for a year, only did remote maintenance, worked wonderfully, didn't really break down. If I was an IT engineer here, that would make me question myself. But actually, it was just a one-off try, and they said it was too expensive to run it long term. But that's kind of fun. So there are lots of great impact. Problem is on the AI side, so the kind of Google brain, so the teams that are actually building these large language models, there's a weird situation where they completely dispute any environmental impacts of AI. And we're not even having this debate of saying, yes, it has a huge carbon footprint, but we think it comes with amazing benefits, which I may not agree, but it's a fair debate to have. No, they're saying there's no carbon footprint. Please keep walking, it doesn't exist. So, this article from a couple of years ago was kind of bonkers. Carbon footprint of machine learning training will plateau, then shrink. Still waiting. You got the tweet that was announcing it from the lead author, and then you got this second sentence. On Google Cloud, the net zero footprint is zero, obviously, but it's still good to focus on reducing energy, and nothing is right with that sentence. But anyway, it was a bit disappointing. So I'm French. I learned machine learning in France. You can imagine that Yann LeCun there, who is head of AI at Facebook, one of the Pope of computer vision, is kind of God on earth in France. You can't really learn machine learning. That's part of the religion. So it was quite disappointing to see him completely attack that. He has a personal vendetta against EcoInfo. EcoInfo is, CNRS is the National Research Center. So that's a very well-established, recognized researchers across France. EcoInfo is the research group on sustainable IT. So the translation is not great, but basically he called them a medieval obscurantist or something like that. Yes, that was his official characterization because they had suggested that maybe we should think about the carbon footprint of AI. And the reason I highlight these two is because I think they're probably both big enough to stand behind their tweets, but also that's a really terrible message for early career researchers. You have young AI researchers that are really bright. They really look up to these people. They think they are the real deal. And when they come out and say, nah, environment we don't care about, don't listen to everyone who tells you otherwise, that really does damage. And also, this kind of quote didn't age terribly well. So last year, we had the first reports that came out of after the whole ChatGPT thing. So first sustainability report, Microsoft reporting 30% increase in 3 years. Google, almost 50% increase in 4 years or something like that. Now remember, these companies were on reasonably sharp net zero trajectory. So it's not like, oh, it's business as usual. It is a very sharp increase. And actually Google said, oh yeah, this increase is all because of AI. But at the same time, they also tell you that AI has negligible AI carbon footprint. So don't really know how that works together. Anyway, they said it's all because of AI. And if we keep deploying AI, that's going to endanger all our net zero targets. So I was really excited. I thought the next sentence is going to be, therefore, we're going to rein in the AI. Well, not really. And actually, that was spotted by a Canadian journal. So there are very few, because they didn't actively advocate for it. They just quietly removed the page from their website. It was a big cleanup. At the same time, they also removed their commitment of not using AI for military applications. So, spring clean. So, on the yes side, there are some optimism to have. A few years ago, 2 years ago, we had a workshop in Heidelberg, so in Germany, and EMBO brought in together quite senior representative from a lot of national funders. So UKI, which is the UK national funders, but also the Netherlands, Poland, Germany, France, Spain was there, a lot of countries. And it was really good to have the people who are basically dictating funding policies in their funders. And they all agreed. And that was, so I was there and a few academics as well to talk about the kind of bringing the science to the debate. And they all agreed, we have to think about the carbon footprint of the research we fund. And they actually came up with this text, so that got called the Heidelberg Agreement on Environmental Sustainability in Research Funding. The title sounds like a post-war treaty, but really it's just because we were in Heidelberg. And it was really refreshing because you always think, oh, it's so hard to move funders, And actually, they all saying, okay, we're not quite sure how we're going to do it, and it's difficult to figure out the practicals, but we all really care about that, and we all want to move faster. And all the debate wasn't about, oh, we need to take more time to debate. The whole thing was about, well, we need to get things done now. So that was kind of refreshing, and there's a lot of effort that come out of that. So there's something called Spark Hub that's supposed to come out in the next few weeks or months. I also did some work with France, and France took a different approach. Funders normally say, we're not going to implement a policy until it can work for everyone across our research remit. And you can imagine something that works as well for computing and wet lab and clinical is incredibly hard to come up with. France has a lot of funding that is managed directly by the government, so they basically hijack national funders' money. So all these AI and climate funding calls go through the Department for the Environment. And they said, now any application for this call has to include environmental impact estimate. So if you apply for money to use AI on climate change topic, you have to tell us what the carbon footprint of this AI solution will be. And I worked with them, so they made the assessment to be by the online calculator I showed you, the green algorithm one, so they all have to use it. This way they may all be wrong, but they will all be wrong the same way, which makes it comparable. And so actually it worked really well, and that was kind of an interesting of saying, instead of trying to make it work for everyone, let's take one use case and just do it. And there was very little pushback from researchers, probably because if you apply for AI for climate and you say, I really don't want to estimate my carbon footprint, your application is probably not off a great start. But it also came up with a lot of different benefits. So some people saying, I'm not going to buy new hardware because actually I don't really need it. And now that I can put in the application that I'm not going to do it for sustainability reason is going to increase my chance of getting the funding. So it was a way of getting excuses to people to actually adopt sustainable behavior. So that's been quite interesting to see. And we've got this problem with AI at the moment is that we don't start with a problem and then we find an AI, we build a model. And actually healthcare is kind of an exception to it, where you start with a real problem, then you try to build the AI for it. But too often we start with an AI and then we try to figure out what to do with it. I mean, Microsoft Copilot is an example of it. It seems to be a national sport at the moment to try to put it everywhere. And every time you open a new app, this chart, it's supposed to be marketing argument. I find it completely terrifying. Can you imagine having a prompt on AI every time you open any of this software? Yeah, terrifying. The plot on the left is complete estimate. The numbers might be completely wrong. But it's some estimates of how much money OpenAI is spending on different computing type. And the vast majority of it, you would expect it to be inference. Inference is people using ChatGPT. You expect, that's the core of their business. You would think that's where they spend money. That's not. The vast majority of their money goes into R&D, which just shows how much supply-driven the whole thing is. It's all about putting in front of you as much AI as you can. And if you find a good use for it, please let them know. And that's going to work out. I heard someone in a podcast recently say, if AI was really so good, they wouldn't have to shove it down your throat so much. And that's actually a really interesting case. And that actually links with medicine so well, because once you find a killer application for an AI model, you don't need to convince the clinicians to use it quite so hard. It's kind of obvious. The problem is when you don't have a real use and you say, oh, can you please start using this electronic health record? We don't really know why, and that's going to make your life really hard, but down the line, it's going to be great. So anyway, being this purposeful, need-driven AI could really help with this. And so let's finish a little bit with what we can do about it. Transparency is one thing, acknowledging the carbon footprint of our work. So we started doing it in papers. Other people have been doing it. That's kind of an interesting way of doing it. Green disk is something else. In wet lab, there are sustainability standards, so you can do sustainability certification, get a bronze or silver accreditation. And there was nothing for computing for a long time. And I tried to resist it really hard, but ultimately we're like, no, it really needs to exist. So we did it. So we called it Green Disk. We made it completely free and open access. And the idea is any research group that does computing activities that provides them with a roadmap on how they can do it. What are good applications of AI? Not only AI, but how they can be sustainable. What are easy actions they can take, and then they get a nice certificate for it. So it's completely free, completely open access. You get different certificate. And yeah, that works quite well. You can do scheduling. I talked about it a little bit before. So you can move your workload at times where more renewable energy is available, or in location where more renewable energy is available. But cultural change really needs to be front and center, right? I said it earlier, efficiency doesn't work. We've got these two things, which is electronic hardware, like computing chips and data centers, became more and more energy efficient every single year for the past 20, 30 years, I don't know. The energy usage and carbon footprint of the sector has grown bigger every single year for the same period. And that's rebound effect. We find new use for it faster than we find efficiency gains. So any kind of claim you hear about saying, don't worry, the GPU chips are getting so much more efficient, so the AI is not going to be a problem for long, that doesn't work. Has never worked. I don't see why next year is going to be the same thing. And that's all because of this rebound effect, or Jevons paradox, if you want to be fancy. And that's this idea that you make something 10 times more efficient, people use it 100 times more. You build a second highway, double the number of cars. Didn't really solve the traffic problem. And that's great for some things. That's why, that supports innovation. But that's not great if your initial goal was to reduce carbon footprint. And so this idea of efficiency and sufficiency is really interesting. I quite like this. If you're interested in this aspect, just because of time, I'm not going to go in great detail, but you can check out this paper, which is really interesting, and just shows that different ways of thinking about sufficiency. But really, sufficiency is what we should be thinking about. Good enough for what we're trying to do, not trying to make something as efficient as possible. And remember, that's the target, 45% decrease. If we only focus on efficiency with rebound effect, that's not going to work. So quite important to keep that in mind. So to avoid these rebound effects, that's why we focus so more on empowering people, so much on that. And so we try to build communities. We did that, for example. So we created a forum because lots of people who don't work on sustainable IT or sustainable computing, but actually work on computing and are interested in thinking about these issues, didn't really have a place to connect and ask questions, share best practice, share resources. A lot of the labs taking part in Green Disk, for example, they will share their material. We don't need everyone to reinvent training material. We can use the same. And so that's a community. If you're interested, that's a forum. You can go on there, and there's like monthly newsletter as well. Speaking of community, so we're organizing this conference in May at CERN, but it's also hybrid. You don't have to actually go there. You can very much join online. And we wanted to flip the script. Normally, you have your big conference on different topics in your field, and there will be a side track for sustainability. And we thought, can we do it the other way? Can we have a big conference on sustainable computing and have side track for different fields if appropriate? I don't know if that's going to work, but we thought, let's give it a go and let's organize it. So we actually do it at CERN, which is a lovely venue in May. And finally, to remember, calculators are not the goal. That kind of contradicts everything I've been talking about, but it's worth remembering. We don't want to calculate just to have a final number and be very proud of ourselves for having this number. The goal is to reduce these environmental impacts. Calculators are an important part of it. They're an important tool to understand where the impacts are, what is worth focusing on, but they're not the goal. I quite like the way the Royal Society put that. So in a report from many years ago, so it was maybe 10 years ago now, they say digital technology developed and deployed, they say in pursuit of net zero, I don't actually teach that, must be energy proportionate. So they must bring environmental or societal benefits that outweigh their own emission. And that's kind of sensible, right? It doesn't mean that it has to be environmental benefits. It can be societal benefits. It can be, but you should have a reasonable expectation that what you're doing is going to be a net benefit. And the only way we can really do this cost benefit is if we know what the environmental costs are, and we make sure we include them in our assessment. And in terms of cost and benefit, the whole thing is made even more complicated when we think, and we had some example with embodied footprint and manufacturing early on, that the new smart pacemaker that's being developed, or the new smart MRI machine, or the new Amazon smart speaker, they're not going to benefit the population that are at the forefront of climate change, right? Population in low-income countries that are most affected by that will not benefit from this technology. So that makes the cost benefit harder. We can't just think of it as a global cost benefit and it's okay, right? And okay, I'm flying, but at the same time, I'm planting trees in northern Canada. Because it doesn't really work like that. And it doesn't mean it's bad to try to mitigate things, but we need to think about how different populations are impacted. So yeah, I'm finishing on that. Looking forward to the discussion. Lots of people I should thank. I'll try to put pictures on there, but I have an amazing team that's doing most of the work, really. And yeah, any questions? Happy to take it.
So I would like to invite the panel to join us here. Jay will be sitting here, Chris and Mamatha here as well. Jay Shaw is a Tier 2 Canada Research Chair in Responsible Health Innovation and Research Director of AI, Ethics and Health at the University of Toronto Joint Centre for Bioethics. Dr. Mamatha Bhatt is a hepatologist and clinician scientist at the University Health Network's Amjera Transplant Center, an associate professor of medicine at the University of Toronto, and partnership and engagement lead for the Temerty Center for AI Research Education in Medicine. And Dr. Chris McIntosh is a scientist at the Peter Munk Cardiac Center and the University Health Network Research Institute. He's also an assistant professor at the University of Toronto, holding appointments in medical biophysics, computer science, and medical imaging. Thank you all for joining us to have this multi-center interdisciplinary conversation about some really complex challenges here. So I'm going to invite each panelist to provide some remarks. And then after that, Loïc, I'm hoping that you'll have an opportunity to reflect back on what some of what you've heard, and then there'll certainly be an opportunity for you in the room to be able to ask questions, and those of you online as well. So Mamatha, maybe I could start with you. As a clinician, how are you currently thinking about climate impacts of AI technologies, or do those climate considerations shape your thinking about the value of AI in clinical care?
I would say, admittedly, as someone who both develops and deploys AI tools into the clinical setting to optimize the care of patients, I had not really reflected on the impact of AI tools on climate change until, I heard about Loic's work and through my interactions with the climate change group at the University of Toronto. So I think that is probably reflective of the vast majority of healthcare professionals working in this space. We're very focused on individualizing the care of patients, making the best possible decisions for the patients we care for, that we will want to use the latest technology or the latest innovation to best care for those patients. And certainly climate change won't be a factor in that decision making most of the time. So that's what I would say has been my perspective. Now, I think moving forward, being more aware of this, I think is important. But we can get into that further in the discussion because I think it's important to realize that current practices in healthcare are quite inefficient and wasteful. So the reality is that there is a significant impact of the way in which we practice medicine as it is. So I looked at some data in this regard. I'm happy to elaborate on that. I don't know if we're introducing ourselves at this point, or you'd like me to expand on that?
Well,
yeah.
It would be interesting because I think what you're doing is you're immediately raising a question that we should probably be chewing on, the inefficiency now and the promise perhaps that AI provides, but also the challenge that Loïc is
Yeah.
saying about, is it about efficiency? Like it really is what it's driving. So please continue.
Yeah. So as a practicing clinician, there are a lot of inefficiencies that I see. So, we could be much less wasteful in terms of the number of tests we order, whether it's blood tests or imaging, supply chains as well can be inefficient. We may be wasting medications, like when they're expired, we are throwing them out. There's a lot of waste that is generated in healthcare, and we don't do a great job of, disposing of the waste in hazardous waste versus, recyclable waste. So in fact, I looked at this data just in preparation for this panel, but in fact, apparently, it's estimated that 4 to 5% of greenhouse gas emissions worldwide are accounted for by healthcare use. So, and that increases to 8.5% in the United States. In Canada, it's 4.6% of our greenhouse gas emissions. So perhaps there are efficiencies that we can achieve through the deployment of AI tools, including, in low-value care, which is, for example, like reducing clinic visits, making more virtual care or remote care assessments, supply chain efficiencies, and other areas where there could be much more efficiencies, I think. So, perhaps in that regard, there is potential for AI to help reduce climate impact. Then, when you're making certain decisions around, early deterioration risk assessment or decreasing inpatient readmissions. Inpatient admissions are actually very carbon generating, so carbon emissions generating. So there's a lot of potential for efficiencies, I think.
Great, and thank you for your honesty too, kicking this off and saying, wow, you're coming to this with new eyes now.
Yeah.
That maybe it wasn't entirely on your radar, exactly. So,
No.
and I think that's probably something that folks, many others in the room would actually relate to that. So thanks for opening the space for us to learn and reflect on this work together. So maybe I'll move over to you, Chris. As a computer scientist, how are you thinking about, the climate impact of the work that you're doing?
Yeah, thank you for having me and for the great talk. That's a very good question. So at least when I went through school, we certainly weren't trained to think about it. I don't know if modern undergrads are. You'd kind of hope that they were, at least, a little bit. And so I sort of leave it to primarily others in my field to worry about, if that makes a degree of sense. And so kind of my expertise is in building machine learning models, specifically in healthcare. And I do have peers whose expertise is on reducing the energy. And you talked about they are making some strides in this, but obviously not enough in reducing the energy of GPUs and reducing the energy of computers and that kind of stuff. And so I sort of hope that those people will work as diligently and as hard as I do and therefore kind of make equivocal strides. But then, you brought up a really good point about how even if they do, we'll just increase the amount that we use it that I hadn't, fully considered. So that's a really hard one to kind of to balance. And I don't know how best we reduce usage either. Obviously, I'm a proponent of using technology, but I think, as been brought up, we have to figure out ways in which we're using it that actually does do net benefit. So to Mamatha's point of potentially reducing other tests that we're doing, reducing, using overuse of medications and various things. So it's kind of, it's easy as a computer scientist to build the models. It's very hard as a computer scientist to kind of control the degree in which they get used, I suppose.
Right. Well, and there's energy implications of both those ends, the development of and the implementation of. So is there an opportunity then within computer science to be thinking about, are there some technical solutions perhaps about the development, or are there other solutions within the field that could actually be, considerations about how we assess the impact, maybe not the assess, but minimize potentially the impact even of the development of those models?
So that's another very good question. So I tend to go back on, necessity is the mother of all invention. And so I think in a lot of labs, and certainly mine included, we do try to build more efficient models because we kind of have to. We don't have the compute power that Google does. And so it's always really interesting to see, these reports come out and stuff of how much they've used to train their latest model.
Yeah.
At least in the healthcare space, when we benchmark our models against their models, we tend to be fairly competitive, if not beating them. And we spend, still reasonable amounts of money. We, spend $100,000 or something like that training a model, but they spend, $100 million. And so correspondingly, they obviously also have a much, much larger carbon footprint. And when I talk to students and trainees who have gone and done, research internships at the companies, it is because you're right. There is a mentality there of, we have infinite compute, so just go use it. Whereas in the lab setting, my mentality to my students is a little bit more like, well, no, we have this many GPUs, so if you're running something, you better darn well need to be running it. And if you don't need to be, then I'm going to be, pushing on you. And so I think it is happening, but perhaps, to your point, if Google hadn't erased that from its website, then they may be forcing their engineers a little bit more. I think it will happen as their as their costs become an issue associated with it. Right now, Google in particular is in kind of an identity crisis, because if OpenAI is able to supplant them as a search engine, Google will stop existing as a company, right? So I could see their internal kind of view right now being is we'll spend whatever we need, because we either, we sink or die by this, but you would hope once it settles that they'll then try to, maximize profits again, which means reducing spend, which would decrease carbon, not intentionally, but as a side effect.
It's interesting because in some ways, scarcity of GPU actually fosters creativity in a different direction. So we're having to use what we have differently to achieve really high quality results. And on the other hand, it's interesting when we think about how there are so many levers and so many inputs towards fostering innovation. What might this look like if we were, and this is a general question, I'm not putting this to you, Chris, necessarily, but it's like what would be the levers that would foster innovation in environmental computing, right? So, and I think we need to be mindful of this, that we are embedded with institutional settings that have certain incentives built in for certain types of outputs and productivity, and so those are inherited, and those are also possibly changeable. So when Loïc, you ended on the culture comment, I wonder if there's something in there that we might explore. But Jay, I want to come to you next, though. So you're coming at this more from an ethics perspective. How do you make sense of the climate impacts of AI as a technology these days?
Yeah, thanks, Jen, and thanks, Loïc, for a great talk. Just really well laid out and easy to follow. So thank you. I've been thinking about this, sort of taking a step back and trying to see the forest throughout this afternoon, listening to Loïc and others. And there's, in the field of design, there's this subfield called speculative design. And in that field, they often come back to this question of what is the world we want to achieve? Like what are, in a big picture, what's the world we're trying to achieve? And is this endeavor helping us to achieve it? And I'm thinking, in relation to healthcare and public health, but then also, of course, in relation to AI and this class of technologies that we're talking about today. And in relation to healthcare, this question would kind of motivate me to ask, like, what are the standards or boundaries we want to place around healthcare, and specifically around AI for healthcare? And that's an important question, and we have some inputs, and we heard from Mamata about that. And there's a history here as well with initiatives like Choosing Wisely, and the Collaborative Center for Climate Health and Sustainable Care is doing important work on that as well. But then I would also say, in relation, separate and apart from how we think about this in healthcare, is how we think about the AI and its impacts on the public's health. And this is like a different class of AI technologies that I think is worth differentiating. Consumer-facing AI, like ChatGPT, this has a host of impacts on the public's health that we have kind of explored together today. And those impacts are really difficult to understand. I mean, there's proximal impacts like around data centers, and there's distal impacts elsewhere around the world. There's immediate impacts and future impacts. We need to look at planetary health, these 9 dimensions that Loïc showed on the slides. And think about that entire supply chain, and it will require an enormous amount of mobilization to sort of address all that. So I guess for me, just sorting that out, there's AI for use in healthcare, which probably requires a different kind of thinking than AI use in other consumer domains that also has impacts on health. So, thinking that through, I'll kind of try to be brief as I come to a close here. But I see like a couple courses of action. One is to distill down the impacts in all those complex different domains and produce something that's usable and tractable, kind of drawing on a conversation we were having earlier this afternoon. And alternatively, and maybe they belong together, but just like really change how we're thinking about this whole space. And earlier today, raised in conversation was this point about the indigenous leadership and indigenous worldviews that we can turn to learn about our relationships to the world, and that this idea of artificial intelligence is misplaced because this is just one among many tools in that kind of ecocentric perspective that Loïc raised. So, I think that all in all, through all this, I think we need better ways of thinking about the problem and categorizing this. Maybe we need to have separate conversations for health AI than for consumer AI that impacts health. We need more data that can address all these different domains of planetary health, likely. And we're going to need an enormous community effort at a time where our societies seem to be less collective than maybe they have been in the past. I think mobilizing the shared concern and shared interest in working on this space is more important than ever. So I'll leave it there.
Thanks, Jay. So Loïc, you've heard from your colleagues here. I wonder if you have any reflections back based on what you've heard, either counterpoints or additions that you would like to make?
Thanks. All such good points. I couldn't write everything, so I'm not sure, but just a few things. The point first of not really having thought about it, I thought was really interesting. And that touches to the broader point that it's fine to make everyone feel guilty about it, but, well, it's not fine, but people need to be able to do something about it. So you mentioned about being mindful of the carbon footprint of what you do in a clinical setting, and that's fine. But actually, if we don't come with any solution of things you can do differently that don't harm patient, then that's kind of pointless. And if anything, it gives this like eco-anxiety, and it actually completely counterproductive. So that's a really difficult thing in some ways. How do we make sure we also provide the tools for people, and you were mentioning in your setting and all of it, how do we provide the tools to say, okay, that's the problem, but here's what you can do about it. And we've tried to do some of things about quantification, and actually the whole green disk thing was to say, here are the low-hanging fruits. The kind of starting point of the roadmap is easy stuff. Keep track of the laptops you've got, and remember that there are a bunch of laptops in a drawer somewhere. You can give them to new staff. These kind of things. But that's a really important point that we need to not lose sight of, even when we're all thinking about the ethics of it and the grand challenge. But actually, if we ask people to do something, we need to tell them what they can reasonably do. That's within their capabilities. Then you mentioned training and education, and that's such an important point. How do we, and it's starting to grow. I know more and more PhD program, for example. Like PhD is a good time to train researchers in that because, well, especially here, I assume you've got a lot of courses in the first year or so. In the UK, we don't really have training, like compulsory training as part of PhD program, but now we've got this like 1+3 where you get a lot of lectures in your first year and then you do a 3-year PhD. And this first year is great to catch students because they will learn about ethics, they will learn about responsible research, they will learn about open data. So it just completely makes sense to have sustainable research as part of it, and more is becoming part of it. but we need to be better at it. We need to be better. Too often it relies on the lecturer being interested in the topic. So one of the professors actually cares about that and says, I'm going to dedicate a lecture on it. Or the course organizer cares about it and says that. But we need to find a better way to like systematically embed sustainability, because that's just part of good science. Then the point about not having the power of Google and so having to work within your constraints, to be fair, whatever works. Like if the constraint, if the reason to like be sensible with your compute and be more on the sufficiency side than efficiency is because you don't have enough compute, fine with me. It doesn't all need to be always about sustainability for sustainability. I think we don't need to be like all and mighty about that. Like that's fine if it's people find another motivation for it, and sometimes it's financial motivation, and we probably have to work with these different constraints if we want to kind of achieve the behavior we're hoping for. And that's something we kind of lost track of in the area of having unlimited compute. I mean, in the area with AI, we managed to hit the limits, but usually, having very available compute, we lost track of how do we need to make things efficient. And that's something we talked a bit about that earlier, and that's something we can really learn from researchers in low and middle income countries, for example. Because, if you know how to operate a data center in Johannesburg, you have to deal with power cuts all the time. And so you actually build models that are resilient to it. Now try training a machine learning model and switching off the computer halfway through. You will have to start from scratch. Like the whole system's not designed to deal with that. But if you have a system that is a little bit more flexible, well, that's great. You can actually say, okay, well, now we're hitting grid capacity and we have to switch on coal factory. Let's switch off our model. Let's just pause it and wait until we've got renewable available. We normally take sustainability when it comes to low and middle income country for digital on the angle of saying high carbon electricity, how can we provide them with low carbon electricity? But we can actually do it the other way around and learn a lot from how they're doing things and seeing how we can gain a lot of knowledge. So, and that goes with what you were saying about indigenous population and how we can actually learn a lot from it. And I hope we can move more in this direction in the future. The Google Swimmer Sync was such a good point, and that's actually broader than Google. It's all AI companies are kind of working on this winner takes it all model. So they assume that whoever wins, whoever passes the finish line first, and the finish line is moving all the time. We never really, initially ChatGPT was the finish line. But whoever gets it will win everything. And so they think in that setting, they may invest all of them as much as they want because they need to be the first one to the finish. And that's such a twisted mindset that goes counterproductive to anything we're kind of trying to push here. And otherwise, yeah, I mean, Jay, I really like this point, and that came up earlier as well. What is the world we want to achieve? And that's such a great point. And then sustainability is part of it, but it's not the whole debate. I'm not arguing that environmental sustainability should be the only driving force behind research and how we do research, but it should be part of that consideration. And yeah, distinguishing between different types of AI, and I'll finish on that, is really important because it's not the same constraint, deploying consumer level AI and there's an argument that, in a way, we need to lead by example. And it seems a bit unfair, in a way, of saying, well, we're trying to build AI for healthcare. We're doing it with limited settings, so it's not we're kind of rolling out ChatGPT everywhere. Really, we should be able to be left alone. But if we get to a setting where researchers in academia don't care about it, the headline will be, Cambridge researchers don't think sustainability is a big problem because they, close their sustainable computing lab. I can guarantee that this is going to be the headline. And suddenly everyone is like, well, it doesn't really matter. All these people who research it all the time don't care. And so there's this kind of argument that it shouldn't be the priority, but we kind of have to do this performative thing of just showing we care, just to hope other people take it seriously. But yeah, I'll just leave it there. Hopefully we have some questions.
Awesome. Thank you so much, Loïc. And maybe this is a good opportunity for questions from the room and online. So there is a microphone. Zoriana's got it, and she'll be making it available. Just raise your hand, and all I would ask is that you keep your question brief. It'll allow for more questions today. So we've got one from the front right here.
Great. Thank you so much, Fiona Miller. I'm the director of the Collaborative Center for Climate Health and Sustainable Care. Fabulous panel. I take no credit for others did the work of pulling this together. Look, you talked about sufficiency, but I feel you were a little bit glib about just how challenging that concept is. You talked about planetary boundaries. You pointed in the direction of meaningful limits to growth, but I think the vast majority of this conversation has really not really grapple with that. I think we don't really understand. I mean, we don't know what that means. It's like a dirty word, certainly in the health and healthcare space, to talk about sufficiency for good reason, right? There's real challenges there. So I'm not asking for an answer, but I'm wondering if you can reflect a little bit more on the gravity of the challenge here, because there's a way in which our conversation can be about alignment. We can do this and this, we can do this and this. And there's a way in which that's a bit fanciful. Perhaps we can't do this and this. We can't have it all. So could you take up that a little bit more?
Starting with the easy questions. No, that's very fair. And yes, I mean, it is really hard. Part of the problem is trying to, like, what sufficiency would look so different in different settings. And I do agree, I think healthcare is one of the hardest one to kind of really think about it, exactly for the reason is that you can't really ask a doctor to say, well, do this slightly subpar thing for your patient, but you know, in the grand scheme of things, it's going to be worth it because we're going to save 10 kilograms of carbon at the end, and it's going to save that. You know, it makes sense from a purely mathematical point of view. It just doesn't hold up in practice. There are some aspects where it works a little bit better if you don't have this kind of health aspect. If we think about, I don't know, physics research, for example, or if you think about building machine learning models, this idea of sufficiency, like what is good enough performance for the particular task we're trying to achieve. So I think in the healthcare system, we can think of it in terms of, okay, what is a good enough benchmark to hit? And after what level do we not actually get any other benefits? Because there's this kind of thing of saying, we try to build better and better models, but does it actually result in better outcome for patients? And, you know, at some point, it doesn't really matter. You've got this kind of competition of getting the best AI model, but it doesn't really translate. So that's kind of, again, the easy answer. I fully appreciate that. I think it is a really challenging, in a way, I don't want to be coming and say, this is what sufficiency means. It's for kind of each community, it's kind of on purpose. I like, please start thinking about that in your own community and then collectively decide what you think is acceptable. And it's not perfect, but that would be a great step. The same thing as just asking people to just sit down, estimate their carbon footprint, and on this sufficiency point, just say, yes, I think it's a reasonable carbon footprint for the projects I'm trying to do. Now, yes, we could say then everyone will just keep doing the same thing and just think it's always worth it. But I think that encouraging people to just have this one step of pausing and saying, yeah, I think it's sensible. We will curl some of the low-hanging fruit first. And that's not going to be enough, but that can be kind of a good way to slightly shift the culture. I don't think I've really answered it, but yes, it's really complicated, basically.
If other members of the panel might want to dig into this as well, because when we think about, when we talk about the healthcare that we're seeking to provide, we're seeking high quality care that we're providing. But the language of sufficiency starts to move in the direction of good enough if we're balancing environmental considerations in. What does that mean then for what communication with the public might need to be, or what the public's perspectives may be important for actually sort of grappling with some of these quandaries? Anybody want to? Great, Mamitha, thank you.
Thanks. I should say that in some countries, like the US, for example, there is a tendency to order more tests than is actually necessary, depending on the setting. So, and that's the sense I've gotten, like, when interacting with the healthcare AI community in the US, where we have, had discussions around healthcare decisions and human values that color those decisions. You get the sense that there are many more tests being ordered that are perhaps not as necessary for the optimal well-being of that person. So there is, I think, there are areas of our practice where, and even in Canada, it's possible to choose much more wisely in the way we practice. And that can ultimately have an impact on, a downstream climate impact reduction.
Sure, James.
May I?
Dive in.
Yeah, I guess, and maybe to kind of present a sort of critically forward view about this. I think in some ways, healthcare, like the task at hand in healthcare is maybe easier than it is with the rest of the AI ecosystem. I mean, in healthcare, there are people who have an expressed concern about people's health. And so, for example, T-CAIREM, as a co-sponsor of this event, is saying this is an important issue we care about. We want to advance this. I mean, AI used in healthcare, therefore, seems to be more amenable to having that conversation. But also to the extent to which it uses infrastructure offered by big tech companies, it illustrates this connection to the rest of this big tech ecosystem that is, I think has this whole scope of detrimental impacts on the public's health, and that needs to be addressed. Putting this forward sort of to illustrate the counterpoint here that I think probably affirms or is more aligned with the question from Fiona. Like that, the scope of impacts from of ChatGPT, not only on planetary boundaries, but also on things like mental health, are really important, need to be considered, and probably demand some action that goes beyond probably what we would see within healthcare.
So thanks, Jay. One of the things that I've noticed you doing on the panel is sort of expanding what we mean by health, not limited to healthcare, but the multiple dimensions. And there was a comment from online that was also pointing in the direction of occupational health. Where does it fit in here? There's so many intersections in our day-to-day lives where health are engaged and potentially at risk. And so that ubiquitous nature of AI-related technology is permeating the walls of our healthcare system in big ways. There was another question right here at the front.
Can I just add on to
Sure.
that?
Yeah, Amatha,
Like,
please do, and then we'll move to the
Sorry.
last question in the room.
Then the question becomes, if my AI tool, which has a climate impact, will save X number of lives, like what really is then the value? There is a tremendous value of that AI tool, right? So you will have to justify the climate impact because you're saving X number of lives. So I think for any physician using these tools, we are so focused on, we're very concerned and worried about our patients, like on the inpatient service. So Dr. Ross is there. And so, we are constantly concerned about our patients' well-being. And so we're not, there are various things we're thinking about at the same time, and it will be difficult for us to also consider the climate impact. But I think, if the overall organization has that as well in their mindset, I think that's where, the operational efficiencies could be optimized. So with clinical decision tools, I think it's difficult to then place a value on a life based on, as Loïc was saying. But if we can really focus on operational efficiencies, I think that's really, an important climate intervention in healthcare, right?
Yeah, thank you. We have a question right here.
Thanks. Yeah, thanks so much for the panel discussion. I was just thinking back when we implemented Choosing Wisely, and we did that in the cardiovascular space, and we came hard up against the public's demand for the test that we said wasn't actually required. And I haven't heard yet fully from the panel about the impact of the public opinion on this and on models and the incremental value and what the costs are. And I know we have talked internally about citizen panels and other ways to try to engage the public in good conversation with, the imparting knowledge so that it is a really fulsome discussion with the public having a true perception of the balances and what we're talking about. I just wondered what the panel's thoughts were on that.
Very good question, and I was thinking, in lines of the earlier one around, the voice we're missing up here on the panel is the patient's voice, because there is a rational aspect of, if in the process of care someone says to me as a patient, okay, walk downstairs, we're going to do this MRI, and now just because I've looked this up in the past, I know that has about a 5 kilogram carbon footprint on just doing that singular scan, but I'm probably going to do it. even though maybe the physician says, to Heather's point, it's going to increase our accuracy of diagnosing you by 0.1%. I'm like, yeah, 0.1%, I'm walking downstairs. If the physician had said to me, yeah, but you got to come back at 2 in the morning and then do the scan, you may have to wait for up to 6 hours, and it's going to increase the 0.1%, then I might say, yeah, no. So maybe there is this point of, if we're empowering patients where they actually understood the carbon costs of the additional tests, because right now we have free healthcare, so the costs are nothing. So of course when Heather says, do you want the additional test, I go, yes. But if it was, do you want the additional test and it's going to triple your carbon cost for the year? Oh, yeah, no, forget that. So maybe that's the part we're missing, is just kind of that public opinion of how much it's important to the individual patient. Because it's not one answer for all patients, and it's not one answer for all situations of all patients, depending on whether we're talking about, pain or death, or depending on, the actual medical outcome at stake.
Thanks, Chris. We're going to need to leave it here. But it occurs to me, both of these last two comments, and then tying to the last question, is that one way that we might approach this is to leave it on the shoulder of each individual clinician and each individual patient in aggregate to lead to some sort of population level health outcome, which is less environmental impact. But instead, what we might do is sort of refocus on what are the systems of care, what are the systems of research, what are the systems that could together work towards alleviating some of those pressures on the individual patient, on the individual clinician, on the populations who are going to be most affected, which really does call on much more of having the public conversation about this, and perhaps actually inviting much more engagement around what are we willing to give up in order to be able to achieve these broader outcomes for generations to come, and and who should be accountable for doing that. So that's Chair's prerogative's last comment as a floating comment for consideration, hopefully leaving you today with all of you, something that you've taken away from today that's a great dinner conversation for you. That would be success if it stimulated discussion beyond these walls. And into your interactions as well in your day-to-day lives. So unfortunately, we do need to bring this 8th annual JCB lecture on ethics and governance of AI to a close. And on behalf of the JCB team, myself, Jay, and Ene, we would like to express our sincere thanks to Transform HF, to Collaborative Center for Climate, Health, and Sustainable Care, and to T-CAIREM for their collaboration on this annual lecture. I think one of the things that we've realized as centers and as interdisciplinary groups is that there's so much more that we can be doing by doing this together. And so it's been a pleasure and an honor to do this with you. Thank you to all of you who've joined online and in person today. Your presence and engagement, we know that you're thinking, even though you haven't been as much opportunity to ask questions, we know that you're engaging and are thinking through this with us. If you are not currently receiving the JCB's Bioethics Weekly Bioethics Events Digest, or would like to stay up to date on the Collaborative Center for Climate, Health, and Sustainable Care, we would like to stay up to date on these. You can please refer to, there should be a slide here somewhere, where you can access a QR code. Sincere thanks also to AMS Healthcare for its continuing support of this annual lecture on ethics and governance of AI for health. And finally, oh my goodness, thank you, Loïc, for joining us here, spending a few days with us here at the University of Toronto for your superb lecture, the ways that you've actually opened up spaces for our conversation. And sincere thanks to Mamitha, Chris, and Jay for stepping in to some really important generative conversations, but they're also uncomfortable as we're trying to process as individuals and as members of our professional and academic communities what we do next. So thank you all very much. Please join me in thanking our panel and our speaker.